Hi, we're here with
Might do it again.
Hi, we're here with Catalyst for Healing. My name is Dr. Richter. I'm here with Maria, our phenomenal therapist, and Dr. Yanuck. Um, we're going to talk today about journaling and how it can help with depression and anxiety, and how it ties into the ketamine space, how it can be utilized, especially for patients that are going through the therapy as well. I think this is going to be a topic that's sounds boring, but it could actually be exciting, especially when introduced by someone who has a bit more experience than myself in this. So a lot of it is probably going to be asking questions, and Maria, who has extensive experience with
Okay.
that. So, but I'm gonna actually turn to Justin. How often do you journal?
I have not journaled probably in a year.
Oh,
Yeah,
good.
if I'm being
Yeah,
honest.
Yeah.
Yeah.
I can kind of collaborate with that. I feel.
Yeah.
Yeah.
Okay.
It's something that's kind of comes and goes for me. And I
Mhm.
feel like I have it as a tool that when I need it, I go to it. And maybe I should be more consistent, but it's just never that way with things unless they really excite me. And journaling personally never really excited me. I wasn't someone that like looked forward to it, but I just tried to make it a practice for a while. I'm just the how the whole my whole ketamine clinic in that world started was largely because of journaling and kind of starting to
Hmm.
motivate myself and be like, yeah, you really want to do this. You write about it every night. But no, it's just not something I'm doing right now. Maybe you could talk to like, what is the importance of
Yeah.
doing journaling? Do you recommend people do it daily? How do you guide people down this road of like starting journaling?
Well, again, like everyone has a different inclination towards it or not. Like
Mm-hmm.
I started like my diary when I was in second grade, and I've been writing in journal ever since. It's just
Wow.
like
Oh wow.
such a fun way for me to express myself and
Mm.
just get more connected to what I'm a very feeling person,
You're
so it's
more than
like
a
a
good
way to
therapist.
express it. And
Yeah.
so I personally love journaling just as a tool to access my inner world and connect with myself. But other people don't like to write, they won't write. So, I mean, I try to tune into like people's personalities and what kind of appeals to them. It's just another tool. I wouldn't say everyone needs to journal or it's something you should do every day. I think it's a useful activity, especially when we're using ketamine, because we want to remember what the experience was like in the journey. And a lot of times when you come out of a journey, it's, there's so much that happened in it that you can't put into words. But if you can get a little bit of it down, then you'll remember more of it later because it'll go away. Like you'll forget the next day some of the intricacies of what you had seen or what you had experienced. So for journeys, it's super powerful. I personally journal every morning just to kind of check in with myself and access, and it's not long. It's like maybe 10 minutes. I just like kind of a brain dump. I like to include gratitude. I like to include, just different things that I'm focused on for the day or an intention for the day. So for me, it just helps to ground me and keep me centered. Um, for clients, I really recommend it when it comes to triggers, because what happens is throughout the week they'll have experiences where they're feeling anxious or they're feeling depressed, and I want them to start to access and recognize what that's connected to, because often there's a triggering event that brings about that feeling, and then once we have more information about what those triggers are, we can kind of go back and figure out where that trauma originated and resolve that and help them shift some of their behaviors so that they can not be triggered as much. So what I tell people is to create an app. I try to make it as simple as possible because most people don't do what I tell them to do. Create, there's a lot of journaling apps you can use, but I just tell people use Google Docs and open a doc and you can speak into it. And when you have some type of experience, I want you to write out, what are you feeling? Where do you feel it in your body? What just happened? And just speak it into it and set it aside, bring it to our session, and we'll talk about it. Same thing we just talked about sleep. Like if you're sleeping, just write out what are the thoughts, because often you're ruminating about things, and it's a way to get it out of your head and then also to have a container for it. So, like, I'm going to get it out of my head, I'm going to set it aside, I'm going to know that my therapist is going to help me with this because I feel overwhelmed just thinking about it.
Mm.
And so it kind of helps people be able to be doing the inner work with boundaries around it, if that makes sense. Um, so that's when I encourage journaling. It's right now for, I honestly think it is very beneficial to do a little bit every day in the morning when you wake up, but a lot of people aren't going to do that. I do recommend doing it for the triggers just to be able to track that a little bit. And then also post journey, super, super beneficial because otherwise it's like you're in a dream state, so you will forget.
Right.
And so I have clients bring in their journals, or like, I don't call it a journal, but just their notes from like one of their sessions. And it's so much rich information. And then when they're reading it, they're like, oh, I totally forgot that happened. And I saw that.
Yeah.
And then we can go into that more. So super, super important. You guys give, journals out at your clinics, so people write in them right after.
And that's actually, I like that you brought that up, because whenever I think about journaling as, pen and paper, and I feel like maybe I have this attachment with school, it feels tedious. But what you just said, even recording right?
it
And having a transcript, I think that's a fantastic idea to actually make it less daunting, instead of thinking about it in the most typical way, which is it has to be pen and paper. No way.
Yeah.
And do you have any other recommendations for people to maybe jumpstart themselves instead of just always thinking about it as pen and paper? Recording, I feel like that's a fantastic way with the transcript that you can read afterwards. That's phenomenal.
I mean, I have to say, I did for years just type it, because part of it was like it's a little more private. You got your phone acts like you're not having a journal sitting around that someone could read. And it's fine. I personally do like writing. There's something about the connection with the pen and paper, but whatever way you want to do it. I mean, I do think people speaking into, can be less daunting for sure. What do you think what other ways would be?
I mean, I feel like it can be expanded. Just that's kind of what I'm driving at, is I feel like there's just so many ways of how you can capture your own expression. And I think that's what it's about, where I've just stereotypically been always thinking about it as pen and paper, and then I have to write my thoughts out instead of just capturing and expressing myself in ways that I can then recall or relate to later.
Right.
And recording, that could be a way for me. I haven't even thought about having a transcript. Then I feel like I'm a super slow typer. Dr. Yanuck knows that, so
it's interesting. I actually I haven't thought about it either that in that way, because I think it's interesting too. Because one of the limitations for me with journaling is I'll have these fleeting thoughts, positive or negative, but I don't know my journal, and so I'm like I go to that for the evening, and I've lost touch with that moment, and so that can be really valuable. I think something that I'd be curious, and we've talked about this offline quite a bit. I've had quite a few patients because one of the first things we do at our clinic is we give everyone a journal, and that's kind of as like your welcome thing. Like, don't have to use it, but like if you feel comfortable with it, we encourage you to write on it. And I've actually had a couple patients who have mentioned to me when I'm doing my kind of debrief afterwards that for them getting the journal was triggering, because they've gone so many years seeing so many therapists and psychiatrists that they were always told, well, you just got a journal,
right?
And like they felt like it maybe not infantilized is the right word, but like it just made it seem like, oh, the problem can just be fixed by writing my feelings down. Like, that's not the suggestion, right? It's the idea that it's a part of it, though, right? It's something that can be beneficial.
It's another tool, just like all the. I mean, it like
how do you that conversation? How do you?
Well, I always say with every suggestion, because I, first of all, knowing like a very small percentage of people are going to do some of the things, like whether it be exercise or sleep, I just say, here's some recommendations. If you want to try this, maybe it will be beneficial for you. Maybe it won't. Some people might not benefit from it. It's like everyone's so individual. I mean, kind of like we talked about art therapy and music therapy. If you want to express more in that way, express that way. But some people really express through writing. Some people, like you need to find your mode of expressing your feelings that's going to work for you. So I kind of explain it in that way, because of course that's triggering if they're told this is the one thing you should do in order to grow and, get more in touch with yourself. It's like, it's a way. And it, like, for me, it works great, but it might not work great for someone else if it's not their thing. So,
and I'd be curious what your thoughts are on this. Like, and I know what your immediate answer will be like. Of course, there's no wrong way to journal, but I think people have a notion of journaling as I need to convey in a poetic, elevated way my feelings of the day, right, and get them onto paper or get them onto a transcript. But I've had patients that have like described their journaling as like they've started to develop a business plan for this thing they've always wanted to do, and like every night they're kind of putting something into that. And that's actually what my experience was with the clinic. Was like each night I was starting to just like write down ideas that I was having for how to build this space.
Yeah.
I mean,
there's no rules.
Yeah, right.
I mean, I think whatever you feel like, it's just a way to express yourself and to hear yourself in your voice.
Yeah.
And I mean, I think I might have mentioned this on one of the another podcast, but one powerful technique I have clients use is writing with the non-dominant hand is your inner child, and writing with the dominant hand.
Yeah.
And if you try it, it's trippy.
I'm sure I would get like 5 words in 10 minutes.
Right.
No, but once your brain thinks, it's like, what does the inner child need today? And the inner, like, I ask this question because I can neglect my inner child, and I'm kind of like pushed too much. I'm like trying to get too much done, and it's like all of a sudden I'd be like, what does little me need today? And it's like rest comes out like almost every time, and I'm like, that's just interesting. And I can barely write it, but it's like my brain is telling me what the child needs. And so it's just, that's another tool. But there's a lot of I mean, there's so many ways to do it. There's a lot of journaling prompts out there if you need to just have questions to get started. But I just keep it simple and start really simple.
Yeah.
And just write out when things are troubling you or speak into something, just to kind of get an idea of how good it feels to express it. Because we don't want to hold everything in all the time. We want to be able to get it out.
Right. I think there is value in, especially if you're going to be doing this intentionally with a therapist, or if you're entering a space like a ketamine clinic, of like setting the goal of like, I'm going to do this every day for a month, like, and hold yourself accountable to something like that. And if it doesn't feel right after that period of time, it's not going to harm you.
Right.
If it doesn't feel right, then you can disregard it. Another thing that
do it for 3 minutes. It doesn't have to be long.
Yeah. Totally. There are many times where I didn't do it for even that long. Something that I found helpful when I first started was them telling me not to use punctuation, right? Which is like, it sounds like a really simple thing, but it takes you out of these kind of confines that we have in school and stuff where we write, with like perfect grammar, and just start to free associate.
Yeah.
And it's pretty wild what will start to come out, because it really is a form of like open eyes meditation.
And drawing, I mean, you could draw too. It's totally. Like, again, just whatever way you want to express it.
Yeah, I had many spirals on my pages.
Yeah.
When it comes to after the sessions, right?
Yeah.
So, and I've come across this with clients where, we talk about journaling.
Right.
After, if there is an integration coming up afterwards, do you focus more on them capturing anything particular, or more the emotions from the experience, or what do you usually try to kind of promote the patient or the client to focus on after the session, let's say the evening off? Because I do promote clients to try to capture certain things, but have you found anything more helpful than another, specifically in the time after an infusion, especially like the evening off, where we try to have the clients minimize screen time and perhaps actually express themselves a little bit more?
Yeah, I mean, I think, it's interesting because just when you're coming out of the ketamine, you're still a little bit in it for another hour or two. So there's a lot of disorientation with coming out. And when you're in the journey, like what you're seeing is so crystal clear, and you're like tracking everything. That 40 minutes feels like, it feels like about 3 hours where you're just
timeless. Yeah.
It's timeless. And so I think it's like, and I tell people, don't do sentences and try to, it's like, just write down like the colors. I mean, we kind of just want to get a sense of like, what did you see in there?
Okay.
Because mostly it's images that are kind of abstract in some way. And so I can have someone put like, purple cave, went flying, saw that, just wrote words of stuff. And then we try to together make meaning of it, just like you would with a dream, where you wake up and you're like, what the hell was that? And
Mhm.
all of a sudden, when you talk about it, you start to go, oh, wow, that was my unconscious,
Do you try
coming
to
out.
have clients associate feelings with that, or more just what they've witnessed, basically?
I think we're trying to make connections with what they witnessed to also stuff to work on.
Hmm.
Like, what is that connected to some trauma that they need to process and resolve? Is that connected to some area of growth that they're leaning into? So we try to make meaning of it together because they're not always clear what it is. So I'd say the journaling after is often just to them feeling kind of random,
Hmm.
but once they talk about it, like it sometimes might even take a day.
Right.
We do the
Yeah.
sessions a day after, but once you're processing it, you start to make meaning through it. And so I think they can write whatever they want. It doesn't really matter.
Right.
So yeah, if there's feelings that come up for sure, but sometimes it's more images or
Hmm.
pictures or colors.
No, I mean, that's what usually people talk immediately after the session
Mhm.
about. Um, and I mean, you as a therapist that do integration with patients, do you find it useful when they journal about specific things, or more just very abstract of how the session uh, was feeling to them, or anything after, or more specific things that came up during the session itself?
I mean, yeah, as much as they can get down, the
Yeah.
better, right?
Mhm.
Because there's, again, a lot that comes out in just that 40 minutes that is important stuff that their brain's trying to process
Do
and
you
work through.
encourage them to make meaning out of it on their own, or you would rather just have them capture it after, before the integration, let's say,
No, I
and
mean,
more
they
just
can try to make meaning of it on their own. A lot of people are making connections and
right?
trying to figure it out. But I think until you articulate it and verbalize
Hmm.
it, sometimes you're not able to, I don't know, see the whole picture.
Got it. Yeah. Yeah.
Yeah, I think there's also a lot of value in, the experience is one thing, but I think over the ensuing days, a lot of things start to come up too.
Yeah,
And
for
so I
sure.
think, not to go out on a limb here, but I think the traditional psychedelic assisted psychotherapy was very much like the patient's getting the drug and you're with them as they're doing it, you're kind of guiding the experience. And immediately afterwards, you're integrating.
Right.
And that might work for other psychedelics, but with ketamine specifically, I think it's during it, it's almost impossible and not not ideal. And then afterwards, they're still out of it, like a little dissociated. It doesn't make sense to do it. And
Huh.
so I think journaling can be really valuable. So yes, try and recollect the things that came up during the 40 minutes or whatever. But I think it's also equally valuable over the next day or two. Things are going to start to come up
Yeah.
that you've been kind of bearing as your mind is more open. And so really, the experience is being a whole induction.
Yeah.
Really, it's not a 40-minute infusion. And so what comes of it comes of it, and then they have a therapy session with you or whoever
Right.
a couple of days later, or the day after, or the afternoon after, and
Right.
that's where they can kind of like process it. But try and be careful about like not pressuring them to do like you have to do this afterwards, and just be like, do what feels right. This is my general
Of course.
recommendation, of
Yeah.
course. Take it from there. We have some patients afterwards that will just record, like we'll use their phone and we'll just have them record the things that they're saying
Hmm.
I
afterwards, and
think
that's
that's
kind of
great too.
I
Yeah.
didn't even make the parallel, but that's what you're suggesting you can do
Essentially,
as
yeah.
journaling.
Yeah.
You're
I
just
mean,
not
that might
actually
make it
physically writing
easier
it.
for people. Yeah.
Totally,
Hmm.
especially after a ketamine infusion. Okay, do we have anything else we want to add to this?
No.
I think